Hello and welcome to the Functionally Enlightened podcast with Dr. Sharon Sarita. We interview well-respected medical and functional practitioners, as well as patients who have overcome disabling chronic conditions, such as dysautonomia, and reclaimed their health. These enlightened guests provide helpful tips on managing chronic pain and illnesses, using a combination of traditional and whole-body healing modalities. If you're interested in natural healing and quality of life improvement, you're in the right place. Thank you for listening to today's episode.
Hello, everyone. Welcome back to the Functionally Enlightened podcast. Today, we have another very special guest, Nicole Bell, who is the author, entrepreneur, and the CEO of Galaxy Diagnostics, which is a company that's really dedicated to transforming that standard of care revolving around tick-borne diseases. We've spoken to a few other experts in this journey for tick-borne disease and prevention and treatment, but here we're going to get a totally different perspective. So I'm really excited about this recording. And so her path to this work was really deeply personal after losing her husband, Russ, to complications that remained undiagnosed, untreated for Lyme disease. And so she became a widow and a single mom of two. That tragedy propelled her into advocacy and innovation, and she drew from her expertise. She has a solid engineering background from MIT and Duke. And so she really explored why Lyme disease is so often missed, why millions remain chronically ill even after treatment. And she wrote the award-winning memoir, What Lurks in the Woods, which chronicles her family's experience. And it's inspiring to others so that they know they can demand better from the medical community. Today, she leads Galaxy Diagnostics in its mission to improve diagnostics for Lyme and the related infections, while also advocating for awareness, the needs for additional research, and patient empowerment. So thank you, Nicole. Once again, we appreciate you taking the time out of your busy schedule to share some time with us.
Oh, no, thank you for having me. It's a pleasure to be here.
Absolutely. Can you share your personal journey with your husband's illness and how it really led you to this mission?
Yeah, so, unfortunately, lots of people in tick-borne disease kind of get dragged into it unwillingly, right? And so my husband's condition started first really with more mood disorders. So he was depressed, he was anxious, he was irritable. And, they were things that I attributed to lifestyle, right? We had a lot of changes. He had kind of stepped back and retired from his job to be Mr. Mom and take care of our young children. He was, we were newly married with young kids. So there were a lot of lifestyle changes that had occurred. And I was like, maybe you should go back to work, right? Like, this is not really working out for you. But therapy didn't help. And then I eventually realized that there were some significant cognitive issues. So he was a brilliant engineer, electrical engineer, computer scientist, and he couldn't remember the time to pick up the kids from daycare. He couldn't remember the 4-digit code to our house security system. And so that was when I realized that there was something more sinister going on than, unhappiness or depression, which are in and of themselves difficult. But this was like, there's something going on here that's really making him sick. And so I started researching, and actually Lyme disease was one of the first things that I thought about. And that's not typical. If I've heard a lot of patient stories, and often they take a long time to get to that thought. But for me, it just kind of made sense as I started researching. It was one of the things that popped up. And he was like a huge outdoorsman. He was always in the woods, had multiple tick exposures. And I was like, well, that seems to fit.
Right.
So I took him to the doctor, and he tested negative for Lyme. And they ran a whole series of labs and said that he was, quote unquote, normal on all of his lab work. And then because most of his issues were cognitive, they referred us to a neurologist. And that was when he was given a diagnosis of early onset Alzheimer's disease, which really was kind of jarring because I was still trying to figure out what was going on. I was still trying to convince him that something was wrong because he wasn't really processing that there was something, really wrong with him. As sometimes it's hard to tell in yourself, especially when it has to do with your brain. And they were telling me that not only did he have Alzheimer's, but he was in the late stages of disease based upon his scans. And so it didn't make any sense. And I raged against the machine and went from neurologist to neurologist and couldn't get any answers, and he had no genetic predisposition, no comorbidities, but I kept asking for more testing and nothing popped up. And then eventually, 15 months after that original appointment with the doctor, my brother called me, and his wife had been diagnosed with tick-borne diseases after her own medical struggle. And he's a doctor, and he started to research, and he was like, "Hey, I think this is also what's going on with Russ, and you should get him retested. And here's all the reasons why. I know he tested negative before, but here's all the reasons why that test really isn't indicative of the fact that he doesn't have the pathogen." And so sure enough, we did. I took him back to the doctor. We retested him for Lyme disease. In that case, he tested positive, and he also tested positive for 2 common other vector-borne infections, specifically Bartonella and Babesia. Mm-hmm. And that was really when I realized that he was dealing with tick-borne illness. But unfortunately, we had lost a lot of time, right? It was 15 months after he'd been given a diagnosis of late stage Alzheimer's. Mm-hmm. And he responded to therapy well in some ways, but not in others. And the cognitive piece never really improved. And so he ended up continuing to decline. He went into resident care in 2019, and then he actually passed away in 2022. So it was a journey. And as you said, it kind of changed my perspective and mission in life to really try and figure out how to prevent other people from going down the same path.
Yeah, so kind of going off of that, if you're looking back now, if there was one thing you wish you would have known earlier in the journey, is there anything that stands out?
Yeah, I mean, the thing that always sticks in my head is at that first doctor's appointment, if we had gotten accurate test results, not only for Lyme disease, which was obviously a false negative, but also just if I had known to test for some of the other common co-infections. If we had gotten a diagnosis at that stage, how would our journey be different, right? Would we have been able to test it? And then obviously even earlier, if I had known that some of his mood, changes, and some of his anxiety and other symptoms that I think we often just brush off as normal or just part of life. If we had paid more attention to those symptoms and got him tested even earlier, then where would we be today? I mean, those are questions I'll always grapple with. And getting better testing and better tools to the market is really obviously a passion of mine now.
Yeah. So why do you suppose that Lyme disease is so difficult to diagnose accurately? Because I myself have gotten the traditional or conventionally ordered labs. I think it was run through Quest, and those came back negative. And then I went through years of chronic illness, and that's one of the things that I tested for. I can't remember if it was a Vibrant Wellness panel, but I had some of those co-infections. So why is it so difficult to find this?
Yeah, and that's a great question. And I think something that's really not understood broadly. And the reality is that these infections are what are known as stealth infections, right? They grow slowly, they hide in tissues, they multiply at levels that are much less than what you would consider from a typical infection or an acute infection. Mm-hmm. And so as a result, they can kind of go below the radar, and they're actually below the limits of detection for traditional testing methods. And so, just think about when you think about testing, I think everybody got a little bit of a crash course of testing in COVID, right? It's like, mm-hmm. If you want to know if you have COVID, you don't get an antibody test, right? You get a PCR or an antigen test. But the reality is, because these are stealth infections, the PCR and antigen tests that are on the market are just not sensitive enough. And so as a result, everybody in tick-borne, space ends up using antibody testing, because it's really the only type of indicator as to whether or not you could potentially have the pathogen on board. So mm-hmm. if you go to your primary care physician and you ask them to test you for Lyme disease, they're going to test you with an antibody-based approach. And there's just a lot of flaws with this approach. First of all, the best time to get tested and treated is as soon as you get bit, as soon as you get the infection, because that's when the treatments are the most effective. And it's before the pathogen disseminates into your tissues, where it can be, hide. And so early stage disease is really difficult with antibody-based testing, because your antibodies take a while to develop, right? That's part of your immune response. First, you get what's known as IgM antibodies, which is they're not generally specific. So you can potentially get lots of false positives because it's, it's meant to be the first responder that kind of sticks to everything. And then the more specific IgG antibodies, those come later, but that's like 4 to 6 weeks after the infection. And so you're missing that early critical window when the current antibiotics are the most effective. So it's not great for early stage disease. And then for later stage disease, it's also complicated. So for some reason that's not fully understood, a lot of people just don't develop an antibody response at all. And this has been shown in animal models and humans that, their immune system just doesn't respond and develop the antibodies appropriately. And then also people like my husband who have been sick probably for years, right? Like this had been going on for a long time for him to get to the point where he had, early onset Alzheimer's disease. Your immune system can be suppressed, right? Because when you've been chronically ill, your immune system's not firing on all cylinders. And so, you're measuring your immune response, but you're in a chronically ill patient whose immune system is not responding appropriately. And then sometimes people have overactive immune systems and then doctors put them on immune suppressants, and that can also lower your antibody responses. So there's lots of reasons that it can go wrong to give you a false negative, but it can also give you a false positive because antibodies are notoriously cross-reactive, right? So they're essentially, your immune system looking at surface proteins of the bacteria, and then they develop antibodies to those bacteria, those surface proteins. But bacteria share proteins, right? And so it might be a protein that's not necessarily specific for that particular bacteria. And so you might test positive for the antibody, but it's actually a cross-reactivity or it's not specific because it's actually coming from another pathogen. So on the other side, you have the risk of false positives. And you also have the final issue that it could be confounding, evidence is because if you have Lyme disease, right, and you develop antibodies and then you get treated, but you still don't feel well, right? You're still going to have antibodies. And the reason, but the key question is are you still developing or dealing with an active Borrelia, the bacteria causing Lyme infection, or you're not feeling well for some other reason? Maybe you have an undiagnosed co-infection. Maybe you have immune dysregulation caused by either the pathogen or the treatment. And so your antibodies are going to be positive either way because sometimes they can stay elevated for years. And so it really doesn't help the doctor figure out what's making you sick today after you've had treatment. So there's lots of reasons why the current testing is flawed. It's just been the only tool that doctors have had historically.
Right. And you did mention the treatment, how the faster the treatment is initiated, the better the efficacy. But for those people who may have been exposed, we don't always know if we've been bitten by a tick. And as you said, just as your husband got misdiagnosed, he did not receive a Lyme diagnosis early on. That seems to be the trend for those people with compromised immune systems, as you were just saying, like they don't have the ability to modulate that response. And with that in mind, are there any tips that you can provide our audience as to how they can work to better enhance their own inner workings so that when they do get diagnostic testing done, they will have the most accurate information possible?
Yeah, I mean, antibody testing is useful, I think, but one of the things that we really like is direct testing. So the test type that you use matters and the lab that you use matters, right? Because these pathogens are really complex. And so one of the things that we do at Galaxy is, I mentioned antigen and PCR testing, right? It's not sensitive enough through, traditional means. Well, that's the problem that we've tried to solve. It's like, how do we get these tests to be sensitive enough to accurately diagnose? And so we use sample enrichment techniques. We use capture concentrate techniques. We use the most advanced PCR technology that's out there to essentially lower the limits of detection and give better direct detection results. And and that's something that is specific to the pathogen, and it doesn't rely upon the host immune response, right? So you're kind of taking that immune response out of the loop of the testing, which is the preferred approach across all infectious disease, right? Like just like the COVID example that I gave, right? You get the PCR, the antigen test. And so really what we're focused on is enabling that within this space, not just for Lyme disease and that the bacteria causing it, which is Borrelia, but also for a lot of the other common vector-borne infections, specifically Babesia and Bartonella, which frankly can be just as nasty in getting people sick and often come together. So, as my husband had all three, I've seen many other patients in similar situations where they have these co-infections. And as I said, when you asked what would I do differently or what would I wish I had known, I wish I knew that you should also be testing for these co-infections, because if you first get exposure to a tick, yes, you can test and see if you have Lyme disease, but that tick could also be carrying Babesia. And Babesia is a parasite, not a bacteria like Borrelia. And so the doxycycline and the antibiotics they're going to put you on for Borrelia aren't going to have any impact on Babesia. So you can get treated, you can cover the Borrelia, but you could actually still have an infection that propagates and leads to long-term illness. And actually, one of the things we're investigating is the role of Babesia in chronic fatigue, because there's been a lot of correlation in the research community about showing the linkage between chronic fatigue and neurological symptoms. And so it can really progress to complex chronic illness that you're better off getting early.
Right. And you have discussed a little bit about what sets Galaxy Diagnostic testing apart and how it differs from standard of care. But I know, and looking over some of the information on your website, that you use a growth medium or something similar, like the stormwater municipal facilities, that they do the testing and they have to use a specific procedure so that you can get that lower detected limit. Can you talk to us a little bit about that?
Yeah, so we have two different approaches that we use. And this is important because these pathogens are stealthy, you really need to understand the microbiology and where they live and how to find them, right? Because if you look at Borrelia, right, Borrelia has two major classifications. If genus is kind of the high level, like that's Borrelia, but there's lots of different species underneath that. And so different species can cause different types of disease. So for example, Lyme Borrelia, those bacteria don't like to be in the blood. As soon as they in the early stages of disease, they spread in the tissue. That's what leads to the rash that some people get, but not everybody. Right. And then it disseminates very shortly in the bloodstream to kind of get to the tissues, but that's a short window. And then it really likes to hide in the tissues. And so for Lyme disease and for Lyme Borrelia, we actually use a urine antigen test. And we don't use a blood test because, again, it doesn't like to be in the blood. And so, but, one of the things it does is it's constantly shedding its coat, right? Like it's changing its outer surface to confuse the immune system and to do different things in the body. And so those antigens and those proteins that it sheds off actually are filtered through the kidneys and they aggregate in the bladder. And there's also evidence that the bacteria itself likes to be in the bladder. And that's actually in early research. That was how they would show whether a mouse was infected. They would harvest the bladder and then use PCR on the bladder. And so urine is actually a great sample matrix for Lyme disease. And so we basically use a capture and concentrate technology where we say we take the urine sample, we use proprietary beads that essentially collect all of the antigen that's in the sample, and then we run it through detection. And that's been shown to show great results in very early stage disease before antibody detection actually starts to generate. And then it's also good for later stage disease, and doctors that are using our testing are actively using it for those complex patients, right? The ones that have had treatment or have a chronic illness and they're trying to figure out, is Lyme still active, in this patient? And, we run the test. And if you see these elevated levels of antigen, you say, hey, this is still likely a huge contributor to your case. And so it's good in the various stages of disease to kind of help providers know when Lyme's on board. So that's for Lyme Borrelia. But there's a whole nother kind of Borrelia, which is the relapsing fever Borrelia. And that acts differently. That does like to be in the blood. And it's actually even transmitted by a different type of tick. So Lyme Borrelia is like the hard ticks, the deer ticks, whereas recurring relapsing fever Borrelia is more from the soft ticks. And so That bacteria does like to be in the blood, as does some of the other co-infections, specifically Babesia and Bartonella, which are the two other common vector-borne diseases in North America. And so for those pathogens, we use a blood-based technique where we essentially, like, as you said, we use a proprietary growth media. That one's specific for Bartonella because Bartonella is a low abundance pathogen and often in those kind of low numbers. And so we have a proprietary culture media which grows it up so that you can get it to levels that are detectable. And then we also use an advanced technique which is called digital PCR. And the way that I describe this is if you think about conventional PCR, this is like what you would use for COVID. Trying to use that technology for low abundance pathogens is like trying to find a needle in the haystack, right? You've got a very small quantity of this pathogen in a whole bunch of human DNA, right? And you're trying to find that needle in the haystack, and you basically have one shot with conventional PCR. But what digital PCR does is it takes that haystack and it separates it into 26,000 piles, and then it interrogates each one individually to say, okay, is the needle in this pile, right? And so you're essentially, because you're dealing with a much smaller stack, you're increasing your signal to noise ratio, and that increases your ability to detect these low abundance pathogens. And so that's what we're using for the blood-based detection. And that technique has driven a lot of discovery in the research setting and then now at Galaxy, where we're uncovering really complex cases of people who have been sick for years and have never had an indication of what that is. And we run the samples and we see you have Bartonella or you have Babesia and really trying to figure it out. And that hasn't been available before because the testing just wasn't sensitive enough.
All right, Nicole, thank you so much for making that distinction. I know I learned a lot there, and I hope our audience can understand the difference between the types of testing, what is necessary, and maybe the whole compilation of them is necessary in times. So with that, kind of throwing it back, I have a couple of questions. With the urinary component, urinary testing, is there provocation that's recommended before doing that type of test?
Yeah, that's a good question. And it's something that we actually want to study in more detail. We do recommend like you get some exercise or maybe a massage or sauna. That certainly can't hurt to kind of stir things up and make sure that if there's something in the tissues that you're excreting it. We've had some physicians who kind of like to do like an herbal challenge or something to kind of improve the ability for the antigens to be secreted, but we don't have robust data that we'd like to study it, and we're looking at studying that. But I think in the meantime, doing some sort of exercise or sauna massage is definitely worth pursuing.
Right. And with the testing, once, I don't know if a treatment protocol is suggested or this is given to a practitioner and then those are kind of bio-individually developed, but is there repeat testing that's recommended? And if so, about what time frame are you looking at?
Yeah, so we often like to see people, one of the things antibody testing is good for is it can actually be used to track performance over time and treatment monitoring. So like, for example, for Bartonella, we report antibodies in titers, right? So it shows you how much antibody you have present. And often with some of these patients, as they get treated, their antibody titers will go up as they're actively trying to clear the disease, and then they'll go down over time. And so you can use that in kind of 4 to 6 week intervals to run testing to see, okay, what is my antibody response doing, and do my titers come down over time? You can also repeat direct testing after therapy to show, okay, is there still evidence of the pathogen in the sample, whether it's the urine antigen test or the blood-based test, and really try and confirm treatment efficacy. Although we will note that there's not really a test for cure, because just because it's not there doesn't necessarily mean it's not hiding in the tissue somewhere. It's just kind of another indicator that you have to align with the clinical picture and where the patient is doing in terms of symptom presentation.
So I'm going to pivot here a little bit, Nicole, if you don't mind, because many of our audience members, they're dealing with implant illness, foreign body responses to whatever implants they received. That's been referred to as Asia syndrome, so an autoimmune, autoinflammatory syndrome induced by adjuvants. So I'm considering any toxicant, so the external toxins that are entering our body, including these tick-borne illnesses, to fall in that category as well. And they're finding it very hard to diagnose those conditions. There's no conventionally recognized term for implant illness. But do you see parallels between their experience and those in the tick-borne illness community?
Yeah, I mean, I like to think of the immune system as like a tipping point, right? Or a bucket. You can use either analogy, but you're allowed to, your body can deal with a certain level of toxic burden or pathogens, right? And your immune system will keep it under control, right? Like this is like my husband. I think he had these pathogens on board for years and he was healthy, right? Like there was no outward signs that he was not well. But over time, as your toxin exposure increases or your pathogen exposure increases, or maybe you have some other immune assault like chronic stress or a traumatic event, right? Either emotional or physical. Mm-hmm. And then all of a sudden you reach that tipping point, or if you go to the bucket analogy, the bucket overflows, right? And you can't, and now all of a sudden your immune system can't keep up. And that's when you kind of descend into illness. And so a lot of these things generally, like I have yet to meet a lot of chronically ill people that had just one thing, right? It's generally, well, I have this pathogen and that pathogen, and I have some toxin exposure, and I had some mold exposure, or I have an implant, and then that's led to issues. And so it's really a complex web, or that you need to untangle and figure out, well, what's front and center, and which one do you attack first, mm-hmm. based upon your health status, and navigate quite close, quite carefully. I mean, you mentioned treatments. There's all sorts of different treatment protocols, and a lot of that just depends on the individual person and what they're dealing with.
Right. And the sensitivity of that patient or client. And so what advice would you give to patients who are feeling gaslit or dismissed by providers when they know something's wrong with their bodies? Maybe they haven't pinpointed, as you said, multiple things have been happening, but is there something they can do independently to move forward with trying to get this diagnosis?
Yeah, it's hard, right? Because you have a doctor, and sometimes many doctors in positions of authority saying, you're fine, everything's okay, it's all in your head, right? And the one thing I would say is you might not be an expert in medicine, but you are an expert in you, and you're the only expert in you. And so when something's wrong. And so continue to advocate and continue to find that doctor that will listen to you and take the time to untangle the web and to figure out what it is. I mean, it was a journey for us. It took us a long time to really get to the answer. And unfortunately for us, it was a little bit too late. But that drive to continue to get those answers and to know that there's something not right and something not fitting is important. And the other thing that I think people fight with in the medical community is labels, right? Mm-hmm. Like, Alzheimer's disease is really not a disease, it's a symptom, right? Mm-hmm. It means that your brain is systematically destroying itself. And the cause of that condition is really not known. And I think there's more and more evidence that's emerging in the literature that shows pathogens are a key issue. There's lots of different ways that you can descend into Alzheimer's. It can be metabolic, it can be hormonal, but it's also can be a toxin or a pathogen. And so, there's lots of diagnoses out there. Fibromyalgia, chronic fatigue is my favorite one. Like, that's not a diagnosis, that's a name for a symptom, right? Mm-hmm. And so, it's difficult because, like, with us, my husband with Alzheimer's disease, it's like, oh, he has Alzheimer's, come back in 6 months and we'll track your decline. Yeah, right. And it's like, this was a very healthy, young individual. It's like, why he has no genetic predisposition. Why is his brain destroying itself? And so asking those questions and demanding that you get an answer from your doctor as to why these conditions are occurring, I think is difficult, but I encourage people to keep going until they find somebody that will go on that journey and exploration with you.
I agree with you 100%, Nicole. And with that, with the being gaslit, there are so many functional labs now available. Unfortunately, your insurance doesn't usually cover it, but sometimes it takes that resource to start digging deeper because you only get 10 or 15 minutes, if even, with a practitioner, and there's no way they can review your history. So getting those pieces, and in functional diagnostic nutrition, we look at all the hidden stressors, deep dive into clinical correlations. So questionnaires, the person needs to really know what are the influences with diet, environment, rest, sleep hygiene, and exercise, or the ability to move, because a lot of our audience members come from movement impaired medical conditions. So understanding that the toxins are not escaping. And then there's that genetic predisposition. So we have to work with all of those things. And I love to now, I've modified how I approach things in my questionnaires. I do ask a lot more about the environment, potential exposures, because this stealth infection can be a part of it. And so for, not just the people I work with, but for our audience members who want to pursue this avenue of testing, is there a resource for them that they can learn more?
I mean, I think in general, for testing on vector-borne disease, you can go to Galaxy's website. We are in the process of redoing it, and in the end of October, we will have a resource education center where we have a lot of information to kind of train patients and clinicians on why the testing is flawed, what types of tests you should be looking for, what are these pathogens, and what symptoms do they lead to. And to your point on exposures, I want to add, we often talk about ticks because, Lyme and Babesia are commonly transferred by ticks. But one thing people don't realize is that your pets are actually a big exposure area. And Bartonella is actually considered to be primarily a flea-borne disease, and and cats are a reservoir. And a lot of house cats, and whether they're inside or outside animals, actually can have Bartonella in very high quantities. And so if you get a scratch from an infected animal, if they lick an open wound, if you have a flea infestation, that's an exposure event. And so people think about ticks, which you may or may not see. A lot of people that we see with chronic tick-borne illnesses don't ever remember getting bit by a tick, because especially the nymph ticks are really small. But also think about your pets, right? Not only are they bringing these vectors into your home, but the pets themselves can actually have these pathogens on board and be exposure issues. And so those are things that, to consider. I think specifically to Lyme disease, back to your question on resources, in my advocacy work prior to joining Galaxy, I worked with the Center for Lyme Action to write the state of Lyme disease research. So this was a summary of all the fantastic progress that we've made in the last 10 years on the research side, essentially showing what Borrelia does to the body and how it's linked to chronic conditions. And it's a resource that I wish that I had when I was dealing with Russ's condition, because we wrote it for congressional staffers as a way to lobby NIH and other kind of federal agencies for more funding. And so we tried to take very technical subject matter and make it accessible. And so I like to give this as an option to patients so that they can kind of understand the latest in research. But I've also encouraged patients to give it to their doctor, right? Because a lot of doctors, they're seeing lots of patients. They may not see a lot of tick-borne illness, or they just don't acknowledge that it's tick-borne illness. And so this is a good resource to provide, to your doctor, to say, here's the summary of where the least research is, and some of the backing to show that, this is something that should be, realistically considered in your practice and in my particular case. And so I think I wish that we had that for all pathogens at this point, but at least for Lyme disease, which is one of the most common, that is something that you can find on the Center for Lyme Action's website.
Amazing. And we will provide links to those on the show notes for the audience, and also to the website, because they can learn a lot about how the diagnostic is performed too, for those people who are more science driven. So I appreciate that. And just, as we come to a close in our talk, there's a couple of things, like if we're looking beyond the diagnostics, what lessons have you learned about resilience and stress management, and even self-care as a caregiver? Sometimes that becomes like second or even tertiary to being the caregiver. So what lessons have you learned over that time?
Yeah, I mean, I've done a lot of hard things in my life, and being a caregiver was by far the hardest thing that I've ever done. And I think the biggest thing I struggled with was, giving myself grace, right? Because, I'm a type A person. I've always done really well in academics and in my career and so forth. And so you think you can just kind of tackle it all, right?
Right.
You're the Sherpa and you throw it in your backpack. And at one point I had a realization is I was literally trying to do three jobs, right? I was trying to do my job, everything that I had been doing prior to my husband getting sick. Then when he became sick, I was trying to do all the things that he was doing, right? The managing of the house, the managing of the kids, all of the things that he was doing in the house. And then I had this third job of now being a full-time caregiver and trying to figure out his medical illness, right?
Mm-hmm.
So I had three full-time jobs that I was trying to manage, right? And so initially I didn't do that as well as I should have. I just kind of said, I can do this and I don't want to ask for help. And I think as I progressed in my journey, I got better at that. And just one, giving myself grace that I can't do it all. And then two, asking for help from, I had, infinite friends and family that were willing to help, but I was afraid I was going to be a burden, right? I didn't want to put our struggles on other
Mm-hmm.
people. But when you reverse it, it's like if that was happening to one of my friends, I would want to help. I would be angry if they didn't allow me to help, right? Because I want to be there for my friends, just like they wanted to be there for me. And so I've gotten better at that, but honestly, it took me almost breaking,
Yeah.
right? To,
Yeah.
to kind of get that self-realization that it's okay to not be able to handle everything. It's okay to ask for help, and it's okay to lean in on your community and really figure out how to do it more effectively. So it's hard.
Yeah.
And if anyone listening is going through it, just give yourself a little bit of grace, because you're probably picking yourself apart about all the things that you didn't do. And that's natural, but realize that it's kind of an impossible ask.
Yeah, and that community aspect is so central too, because as you mentioned, type A personalities that can logistically set aside a plan. And even if things aren't going according to plan, you have the next step that you're going to try. You don't really sit back and reevaluate until you get to that point where you realize maybe all the efforts that you're putting in are being driven in the wrong direction. And that does take some time. A lot of the clients that I work with, they have similar personalities. The majority are female, but I do have, about 20 to 30% that are male clients. And, they're very structured in how they approach things. And they've done that for so long until they get to this chronic illness state where they realize they need the help. And even though it's hard for them to reach out, they're doing the right thing by finding the community that best can be supportive without the negative commentary. Like, it's always a good thing to kind of vet out those communities too. And then find the practitioners that will listen, that will help you do the deep dive. And if you, for any reason, have the gut instinct that that's not a good fit, then you move on and keep searching. So I
Yes.
appreciate all of the insights you've shared with us today. If there's any other tip, like any one tip that you could provide to our audience that is a critical piece of your journey or of the people you've worked with, what would that be?
I think the biggest thing I'm trying to get folks to realize is that these vector-borne diseases are something that should be on your radar, right? Like, it's not just in New England and then the Midwest, right? It's really nationwide. And then most of us travel to different areas. And so the exposure, and like I said, for something like Bartonella, it could be as simple as a cat that you adopted or, got exposure to. And so it's something that should be considered. Work with a doctor that kind of understands tick-borne illness if you suspect that something is going wrong, and just get tested, right? And get tested with the right test, because, just because you're negative on, your standard test doesn't necessarily mean that it's on board. It's not on board. And so I think that's really the key where our journey went wrong early on, and what we're working at Galaxy to make sure that there's better tools available so that other patients, as I said earlier, just don't have to go down that same pathway.
And Nicole, can you point us again to that website?
Yeah, so Galaxy is GalaxyDx.com. And like I said, we'll soon have a learning center that goes along with that. There's lots of access to, podcasts like this, as well as videos and a lot of our publications. We're very committed to kind of doing peer-reviewed publication and being open about our techniques and what we're doing and doing clinical data so that we can, show performance of our assays. And so all of that information will be available. The other resource that I mentioned was at the Center for Lyme Action website. So if you Google Center for Lyme Action, you'll see the state of Lyme disease research, and you can download the paper. We have several webinar recordings where we've gone through key aspects of the paper for people that prefer visual as opposed to reading. That's also available on their website.
Fantastic. Again, we'll keep those links available, and it'll also go out our newsletter. So if you're not on our newsletter yet, try to get on it as soon as possible so you don't miss those details. And Nicole, we appreciate you again sharing that story. That's very touching, and just how the journey kind of evolved into this testing that is now becoming more readily available for those who need it.
Yes. Well, thank you for having me today. And if folks want additional information, they can also reach out. I'm on Instagram at Nicole Danielle Bell, and then also Galaxy Diagnostics. We have Instagram, Facebook, all the things.
Fantastic. We appreciate it. And thank you to all of our listeners. We will see you on the next one. Take care.